What is the latest in follicular lymphoma, and what are the most important highlights for patients and families?
When we look at some of the stuff that's changed in follicular lymphoma, there's actually been some really exciting developments just in the last year in follicular lymphoma. So when you look at patients who have relapsed or refractory follicular lymphoma, we've actually seen the approval of 3 different new therapies just in the last year for relapsed refractory follicular lymphoma. So one of those therapies, we saw a brand new approval, and that's a therapy which is combines an oral targeted therapy with a monoclonal antibody. So the combination of the CD20 antibody obinutuzumab in combination with the BTK inhibitor zanubrutinib was approved in March of 2024 for patients with relapsed refractory follicular. And this was based on a study that compared that to the single agent anti-CD20 antibody. So while we have had CD20 antibodies approved in both original treatment for follicular lymphoma and relapsed disease, it was the first time that we've had a BTK inhibitor approved for the treatment of relapsed refractory follicular lymphoma. In May of 2024, we saw the approval of actually the third chimeric antigen receptor T cell or CAR T cell therapy for relapsed refractory follicular lymphoma. So previously, we've had 2 different CAR Ts that target the same antigen or protein CD19 on the cell. And the third therapy with the same target was approved in May of this year for relapsed refractory follicular lymphoma. And then in June of 2024, we actually saw the approval of the second bispecific antibody for the treatment of relapsed and refractory follicular lymphoma. So previously we had one approved almost 2 years ago in December, and a second one, epcoritamab, was approved in June of this year for patients with relapsed refractory follicular lymphoma. So 3 different treatments approved in this setting in the last year, which increases the options for patients. It also, provides us with thinking about sequencing these agents, and there's a lot of studies ongoing to decide, or to think about what is the best way to sequence therapy, because there's no right or wrong answer currently in which therapy do you choose and when in patients with relapsed refractory follicular lymphoma. And then thinking about managing, when we're choosing these therapies, what are the side effects of these therapies and managing these side effects, right? Because chemotherapy is often used for patients with initial diagnosis, and there's very specific side effects to chemotherapy and ways to manage those side effects. But when we look at some of these newer therapies, we have to think about the different toxicity profiles that they have and how we manage those toxicities. So when we're thinking about the newer therapies like bispecific antibodies and CAR T cell therapies, there's very specific toxicity with those therapies, including cytokine release or CRS, and then something called ICANS, which is immune effector cell-associated neurologic toxicities, which is neuroside effects of these therapies. And so how do we, identify and manage those therapies? And now even looking at, ways to potentially prevent patients from having those specific toxicities.